Okay. Can I have the lights off, please? So this is the topic is what we are calling interesting color Doppler situations where ultrasound not alone can help achieving the diagnosis. You need to have a color Doppler and what is going on there. What we find that a situation like this and right from head to toe we encounter in our day-to-day practice, and at times we are in fix what is happening here and how we can achieve a diagnosis, right from neonatal brain, eye orbit, salivary glands, lips, tongues and cheek, neck and great veins, peripheral chest, abdomen, aorta, and renals, testes, and muscles and tendons and extremities. So all these are the things where we can take the help of ultrasound to diagnose the things what is happening there. Situation like this in a fetus where we can see a fetal head and a dilated cystic mass and then dilated ventricle. What is happening here? It could be an arachnoid cyst, it is a hydrocephalus, or it is just a cystic malformation. But as soon as you switch on the color, you immediately clinch the diagnosis that this is nothing else but this is the dilated aneurysm of vein of Galen. So there immediately ultrasound color Doppler helps you that this is not hydrocephalus, this is not arachnoid cyst, but this is an aneurysmal dilatation of the vein of Galen, and a spectral Doppler tracing tells you that your diagnosis is absolutely confirmed. Situation like this in orbit, when you are seeing here that this is the eye, what is this? We can see these are the dilated vessels, but how ultrasound can help you? And what is happening here in this man who is having the bilateral proptosis and drooping of the eyelid, and there the ultrasound and color Doppler plays a major role in achieving a diagnosis. Like this, what we can see here in an eye, that multiple dilated vessels which are clinically seen and diagnosed, but how it can help us? We can see on ultrasound these are the grossly dilated veins and they are phlebolith here also, and these are the vessels which are seen over there. So these are the conjunctival, long-standing conjunctival varices which are also having the phlebolith inside that. The point is this, whether they can be surgically excised or not, and there the ultrasound plays a major role, how deep they are, whether they are invading the coat or they are just seen over the conjunctiva. And there what we are seeing here, this is the scleral coat, so they are just confined to the sclera, and then we can see the thrombotherapy and we can ligate them. A situation like this where a man who suddenly lost the vision, acute pain in the eye, edema in the eye, sudden loss of the vision. When we did color Doppler, we found the optic nerve is highly edematous, it is inflamed, but there is no flow in the central artery of retina. You can see here, there is no flow seen in the central artery of retina, and this is the occlusion, sudden occlusion of the central artery of retina, which we can see unconfirmed on color flow imaging. Situation like this is a doctor friend of mine who was having the coming up proptosis coming up and going on. He got a CT scan done, somehow it was not done properly. It was not the fault of the CT scan, it was the fault of the proper technique. And when we did ultrasound, we found a dilated vessels in the orbit which is seen pressing over the optic nerve, and as soon as we switch on the color, we found this is the grossly dilated superior ophthalmic vein. Then we have to look, we have to see why it is so. If there is any obstruction at the cavernous sinus, or there is any possibility of the partial cavernous sinus thrombosis, because that may be the cause. And this is the CT scan which we did later on, and we found that superior ophthalmic vein is seen grossly dilated, tortuous, but ultrasound tells you better in these situations. Then in a lady who was also having problem of vaccine weaning proptosis, and when in this situation the CT was normal, it did not tell anything, but when she came to me, she was very confident, and you can see the eye is proptose, and this is the normal eye, and this is the eye which is seen here having multiple dilated vessels. I asked the patient to sit with a book, read it for 15 minutes, and that by keeping the head down, these varices, they got engorged, and after that when we did it, we found that these are the orbital varix which got engorged if you keep the head down, and that's you can achieve the diagnosis. Situation like this in a lady where you can see the proptosis over here, there is diplopia also. When we did ultrasound, we found that there is a mass which is intraconal in nature. Multiple fine, tiny specks are seen over there, but there is no calcification. The mass is seen pressing over the optic nerve, but as soon as you switch on the color, you find these are the multiple vessels. You can see how fast is the color and how high is the flow, and this is a big hemangioma seen sitting in the cavernous hemangioma sitting over there in the orbit, in the intraconal region of this orbit. Then in a man who was having the progressive swelling over the both eyelids, you can see here with the drooping of the eyelid, this is the situation when we found that this is the new vascularization which has taken place in the neurofibroma of the upper eyelid, and these are the multiple vessels which are seen, and this shows you the spectral Doppler flow. This is also showing you the low arterial flow seen in the new vascularization of the neurofibroma of the both lids. Situation like this in a lady who was having a parotid swelling. This parotid swelling used to increase, and at times it became pulsatile, and you can see here dilated vessels which are seen over here on grayscale imaging, and when you put a color Doppler, you see a high flow in this vessel, and this is the spectral Doppler tracing, and this is the AV malformation which is seen in the parotid gland on this lady. Again you can see the local venous malformation in the parotid gland, and this is the grayscale imaging, and this is the color flow imaging. Like this in a man who was having a temporal swelling, this is the CT scan which shows the temporal fossa, the temporal part of the brain is absolutely fine, and there is a soft tissue mass which is seen here, which is taking a high contrast over there, but they said what it could be. The ultrasound could tell you what is that. You can see here, this is a AV malformation of the superficial temporal artery, and venous communication was also there, and this is the color flow imaging, and these are the grossly dilated vessels which are seen over there, and this shows you. So CT did tell this is a vascular mass, but from where it is coming, and there the ultrasound had the role where we could see the artery, where we could see the multiple dilated vessels which are seen communicating, and this is the spectral Doppler tracing. Situation like this in a young child who was having such a clinical picture, you can see the lips are grossly enlarged, multiple vessels are seen over here, and the vessels are also seen over the tongue, and what is the role and whether we can do a corrective surgery on this, and how could hazardous the surgery be. And then we found that the vessels are here on color flow imaging. We found that these are the grossly dilated vessels. This is the tongue, where we can see these vessels are also having the tongue, over the tongue involving the lateral margins, both sides, and also the dorsum ventral surface of the tongue. Not only that, this whole malformation was involving the both cheeks and also the floor of the mouth. So this is such an extensive involvement where we found that AV malformation of the face involving the lips, tongue, both cheeks, and the floor of the mouth. Surgically this was not possible. A case was tried, the similar type of the case they tried to operate in USA in MD Anderson University, and after 38 infusion of the blood they could not remove it. So this information when I gave to the treating plastic surgeon, because this was so important, the extent of involvement of this disease, that in our setting this was not possible to correct and ligate this AVM. Situation like this where we can see on the tongue, you can see here, we can clinically see that this is a local venous malformation, but the point is this, how deep it is, where it is involving the tongue, and this is the tongue surface you can see here, and this is the that is involving almost whole width of the tongue, and these are the arterial flow which is seen in this AV malformation. A boy who was having this type of the tumor over the cheek, and then we could see, and this is the Doppler which shows you this is not that much vascular. We are also seeing thin septa running in this, and this is a typical lymphangioma which was correctly taken out by plastic surgeons. Like situation this, where we found that it's a non-pulsatile swelling over there in the supraclavicular region involving the posterior part of the neck. These are the grossly dilated vessels what you are seeing, and as you switch on the color, you can see the high flow there, and this is again a local AV malformation involving the supraclavicular part of the neck. Like this, where we can see a cystic mass with having a homogeneous ecos in the neck. But when we put a color, we found that this is having a high flow in the capsule. But when you switch on the power flow, then you find seeing the multiple vessels are seen crisscrossing, and this is the case of the supraclavicular lymphangioma. Situation like this, where we can see a pulsatile mass in the root of the neck, you can see here, and this is a aneurysm of the at the origin of the root of the carotid on the right side, and this is the situation where we found a non-pulsatile mass here, and this is the carotid artery, and this is the dilated vein over here, a dilated vessel which is seen here in the neck. Again, it's a dilated external jugular vein. When we are coming, not only that, at times we can see the bleeding vessels in the neck, and this is a patient who had a swelling in the neck. This is the vessel, aberrant artery, and this is the jet of the blood which is coming out from here in the grayscale, and on color flow imaging you can see this jet is going out there, and this is the whole flow which is seen filling in this hematoma. This form ultimately led into the hematoma formation, and this was the bleeding vessel which we picked up on color flow imaging. Like this, we also know what it could be. Some surgeon tried to operate. This patient was having a vascular malformation of the chest, and they could try to operate, but they could not remove it. The point is this, how ultrasound is going to help in this situation, because when I did ultrasound, I found these vessels are not only confined to the chest wall, but they are seen going posteriorly, invading the pleura here, and then after invading the pleura, they are going and invading the peripheral lung. So this is the story here. The story does not end just to the chest wall, but this is the vessels which are going deep down, invading the chest wall, invading the pleura, and then invading the peripheral lung. That's why they could not remove it. This is the case. Most of the time we also do this. You can say it's not a mistake. What we found that the kidney, the left kidney, they thought it's a normal, right kidney they thought it's abnormal, and they passed one sonologist passed. This is a small contracted right kidney, and left kidney was absolutely normal. The patient was referred to me. When I did the ultrasound, I found the right kidney is absolutely fine, which they labeled as a contracted kidney, but the left kidney was markedly enlarged. And when we did ultrasound, I found the AV malformation involving the communication between the artery and the vein, and that's why this kidney was enlarged due to the AV fistula and having the high supply on the left side. Actually, there's a problem was not on the right side, which they thought it's a contracted kidney, but this is the AV fistula which was leading to the left side of the kidney. Again, you can see here, this patient was having the IVP, and then the kidney was seen cut off on this side. They saw there's something wrong over there. A hydronephrosis is there, but there is no stone, nothing. When we did ultrasound, we found that the left renal vein was markedly dilated. This is the right renal vein. This is the left renal vein, which was about twice the size of the right side, which is crossing to the upper part of the left ureter and resulting in the obstruction and causing as a vascular band, and that is the reason this kidney was hydronephrotic, and we could see on ultrasound. Then again we can see on ultrasound, this is the aorta and there is the aneurysm. You can see aortic aneurysm. They thought it's some tumor, but this is the tumor. What we are seeing is an aortic aneurysm. So like this, color Doppler has got role. This is the torsion of the testis, and this is the orchitis, what we can see here. Then this is a forearm. They thought it's an abscess, but this was